Welcome. Today, we're diving into a common yet often misunderstood health issue, hemorrhoids. Many people experience discomfort or embarrassment when discussing this topic, but understanding hemorrhoids is the first step toward effective management. In this video, we'll explore what hemorrhoids are, how they develop, and the ways doctors diagnose them. Whether you're seeking information for yourself or someone you care about, this guide will provide clear, practical insights. Let's start by defining exactly what hemorrhoids are and why they occur. Hemorrhoids are swollen veins located in the lower rectum or anus. They're similar to varicose veins that you might see in your legs, but they occur in a much more sensitive area. Hemorrhoids can be internal, developing inside the rectum, or external, forming under the skin around the anus. Both types can cause discomfort, but their symptoms and treatments may differ. Understanding the basic anatomy of hemorrhoids helps us appreciate why they can be so bothersome and how they're diagnosed. There are two main types of hemorrhoids, internal and external. Internal hemorrhoids are found inside the rectum and are usually not visible. They may cause painless bleeding during bowel movements. External hemorrhoids, on the other hand, develop under the skin around the anus. These can be seen and felt, often causing pain, swelling, and sometimes bleeding. Knowing the difference between these types is important for understanding symptoms and treatment options. Hemorrhoids can present with a range of symptoms. The most common include itching, discomfort, pain, and bleeding during bowel movements. You might notice bright red blood on toilet paper or in the toilet bowl. Swelling or a lump near the anus can also occur, especially with external hemorrhoids. Sometimes, hemorrhoids can become thrombosed, meaning a blood clot forms inside, causing severe pain and swelling. Recognizing these symptoms is the first step toward seeking help. Several factors can contribute to the development of hemorrhoids. Straining during bowel movements, chronic constipation or diarrhea, sitting for long periods, and pregnancy are common causes. Obesity and a low-fiber diet can also increase your risk. These factors increase pressure in the lower rectum, leading to swollen veins. Understanding the causes helps in both prevention and management of hemorrhoids. Certain people are more likely to develop hemorrhoids. Age is a significant factor, as tissues supporting the veins in your rectum and anus can weaken with age. Pregnant women are also at higher risk due to increased pressure on pelvic blood vessels. People with a family history of hemorrhoids, those who are overweight, and individuals with chronic digestive issues are more susceptible. Recognizing these risk factors can help you take preventive measures. While mild hemorrhoids can often be managed at home, it's important to know when to seek medical advice. If you experience persistent pain, heavy bleeding, or if symptoms don't improve with self-care, consult a healthcare professional. Sometimes, rectal bleeding can be a sign of more serious conditions, such as colorectal cancer. Early diagnosis ensures appropriate treatment and peace of mind. When you visit a doctor for hemorrhoid symptoms, the first step is a thorough medical history and discussion of your symptoms. The doctor will ask about the duration, severity, and nature of your discomfort, as well as any bleeding or changes in bowel habits. This conversation helps the doctor understand your situation and decide on the next steps for diagnosis. A physical examination is often the next step. For external hemorrhoids, the doctor may visually inspect the area around the anus for swelling, lumps, or irritation. This simple check can often confirm the presence of external hemorrhoids. The doctor may also gently feel for any abnormalities, ensuring a careful and respectful approach to minimize discomfort. For internal hemorrhoids, a digital rectal exam may be performed. The doctor gently inserts a lubricated, gloved finger into the rectum to feel for swollen veins or other abnormalities. This exam helps identify internal hemorrhoids and can also detect other potential issues, such as tumors or polyps. While it may sound uncomfortable, the procedure is quick and usually not painful. If further examination is needed, the doctor may use a small, tube-like instrument called an anoscope. This device allows direct visualization of the anal canal and lower rectum. Anoscopy is especially helpful for diagnosing internal hemorrhoids and assessing their severity. The procedure is typically done in the doctor's office and takes only a few minutes. In some cases, a proctoscopy or sigmoidoscopy may be recommended. These procedures use specialized scopes to examine the rectum and lower part of the colon. They help rule out other causes of rectal bleeding, such as polyps or tumors. While more involved than anoscopy, these tests provide valuable information for accurate diagnosis and treatment planning. Occasionally, laboratory tests may be ordered to check for anemia or infection, especially if there's significant bleeding. Blood tests can help assess your overall health and ensure there are no underlying issues contributing to your symptoms. These tests are not always necessary, but can be helpful in certain situations. It's important to distinguish hemorrhoids from other conditions that cause similar symptoms, such as anal fissures, abscesses, or colorectal cancer. Doctors use a combination of history, physical exam, and sometimes imaging or endoscopy to make an accurate diagnosis. This careful approach ensures that you receive the right treatment for your specific condition. In rare cases, imaging studies such as ultrasound or MRI may be used to evaluate complex or severe cases of hemorrhoids. These tests provide detailed images of the anal and rectal area, helping doctors plan advanced treatments if needed. Most people with hemorrhoids won't require imaging, but it's an option for complicated cases. Doctors often grade internal hemorrhoids based on their severity. Grade I hemorrhoids bleed but do not prolapse. Grade 2 prolapse with straining but retract on their own. Grade 3 prolapse and require manual reduction, while Grade 4 are irreducible and may require surgery. Grading helps guide treatment decisions and set expectations for recovery. While a doctor's evaluation is best, some people try to check for external hemorrhoids at home. Gently feeling for lumps or swelling around the anus can sometimes reveal external hemorrhoids. However, self-examination has limitations and should not replace professional assessment, especially if you have bleeding or severe pain. Getting an accurate diagnosis is crucial. Misdiagnosing hemorrhoids can delay treatment for more serious conditions. That's why doctors use a combination of history, examination, and sometimes tests to confirm the diagnosis. If you're unsure about your symptoms, don't hesitate to seek medical advice. There are many myths about hemorrhoids. Some believe only older adults get them, or that spicy food is the main cause. In reality, hemorrhoids can affect people of all ages, and diet is just one of many factors. Dispelling these myths helps people seek the right care without unnecessary worry or shame. Preventing hemorrhoids often involves lifestyle changes. Eating a high-fiber diet, drinking plenty of water, and exercising regularly can help keep bowel movements regular and reduce straining. Avoid sitting for long periods and take breaks if you have a desk job. These simple steps can make a big difference in preventing hemorrhoids. Fiber is essential for digestive health. It softens stool and makes it easier to pass, reducing the need to strain. Foods rich in fiber include fruits, vegetables, whole grains, and legumes. Increasing fiber intake can help prevent both constipation and hemorrhoids, making it a key part of any prevention plan. Staying hydrated is another important factor. Drinking enough water helps keep stools soft and easy to pass. Dehydration can lead to hard stools and increased straining, which raises the risk of developing hemorrhoids. Aim for at least 8 glasses of water a day, and adjust based on your activity level and climate. Regular physical activity promotes healthy digestion and reduces the risk of constipation. Even simple activities like walking or stretching can help. Exercise also improves circulation, which benefits the veins in your rectum and anus. Incorporating movement into your daily routine is a practical way to lower your risk of hemorrhoids. Healthy bathroom habits can prevent hemorrhoids, don't delay bowel movements, and avoid straining or sitting on the toilet for long periods. Responding promptly to the urge to go and maintaining good hygiene are simple but effective strategies. These habits reduce pressure on the veins and help keep your digestive system running smoothly. Mild hemorrhoids can often be managed at home with lifestyle changes and over-the-counter treatments. Warm baths, topical creams, and gentle cleaning can relieve symptoms. Increasing fiber and water intake is also helpful. If symptoms persist or worsen, it's important to consult a doctor for further evaluation. Sometimes, home remedies aren't enough to manage hemorrhoids. Persistent pain, bleeding, or prolapse may require medical intervention. Doctors can offer a range of treatments, from minimally invasive procedures to surgery, depending on the severity. Early intervention can prevent complications and improve quality of life. For more severe hemorrhoids, doctors may recommend minimally invasive treatments. These include rubber band ligation, sclerotherapy, and infrared coagulation. Each method targets the hemorrhoid to reduce blood flow and shrink the swollen veins. These procedures are usually quick, with minimal discomfort and recovery time. In rare cases, surgery may be necessary for large or persistent hemorrhoids. Hemorrhoidectomy is the surgical removal of hemorrhoids and is highly effective for severe cases. Another option is stapled hemorrhoidopexy, which repositions the hemorrhoid tissue. Surgery is usually reserved for cases that don't respond to other treatments. After treatment, proper aftercare is important for healing and preventing recurrence. Follow your doctor's instructions, keep the area clean, and avoid straining during bowel movements. Most people recover quickly, but ongoing lifestyle changes are key to long-term success. If you notice new or worsening symptoms, contact your healthcare provider promptly. While most hemorrhoids are harmless, complications can occur. Thrombosed hemorrhoids are extremely painful and may require urgent treatment. Infections, excessive bleeding, or anemia are other potential issues. Recognizing complications early allows for prompt medical care and reduces the risk of serious problems. Although less common, children can also develop hemorrhoids, usually due to chronic constipation or straining. Symptoms and diagnosis are similar to adults, but treatment focuses on gentle management and addressing underlying causes. Encouraging healthy bathroom habits and a high-fiber diet can help prevent hemorrhoids in children. Pregnant women are at higher risk for hemorrhoids due to increased pressure on pelvic veins and hormonal changes. Symptoms can be managed with lifestyle adjustments, gentle hygiene, and sometimes medical treatments. Most pregnancy-related hemorrhoids improve after delivery, but ongoing care is important for comfort. Older adults are more likely to develop hemorrhoids due to weakened tissues and chronic health issues. Diagnosis and treatment are similar to younger adults, but extra care may be needed for those with mobility or cognitive challenges. Preventive strategies are especially important in this age group. Some people worry that hemorrhoid diagnosis is always painful or embarrassing. In reality, doctors use gentle, respectful techniques and prioritize your comfort. Most exams are quick and cause minimal discomfort. Open communication with your healthcare provider can ease anxiety and ensure a smooth experience. Dealing with hemorrhoids can be emotionally challenging. Feelings of embarrassment, frustration, or anxiety are common. Remember, hemorrhoids are a medical condition like any other, and seeking help is a sign of strength. Support from healthcare providers and loved ones can make a big difference in your journey. Open and honest communication with your doctor is key. Don't hesitate to describe your symptoms in detail, even if they feel embarrassing. The more information you provide, the easier it is for your doctor to make an accurate diagnosis and recommend effective treatment. Remember, your health and comfort are the top priorities. When visiting your doctor, consider asking questions about your diagnosis, treatment options, and prevention strategies. Understanding your condition empowers you to make informed decisions about your health. Don't be afraid to ask for clarification or additional resources if you need them. Follow-up appointments are important for monitoring progress and adjusting treatment if needed. Your doctor may want to check your healing, address any new symptoms, or provide additional advice. Staying engaged in your care ensures the best possible outcome and helps prevent recurrence. Many people find comfort in support groups or educational resources. Online forums, patient organizations, and healthcare websites offer valuable information and a sense of community. Connecting with others who have similar experiences can reduce feelings of isolation and provide practical tips for managing hemorrhoids. To recap, hemorrhoids are swollen veins in the rectum or anus, and they're a common cause of discomfort and bleeding. Diagnosis involves a combination of history, physical exam, and sometimes additional tests. Early recognition and treatment can prevent complications and improve quality of life. Remember, you're not alone, and help is available. If you suspect you have hemorrhoids, don't ignore your symptoms. Early diagnosis and lifestyle changes can make a big difference. Consult your doctor for personalized advice and treatment options. With the right approach, most people can manage hemorrhoids effectively and maintain a healthy, comfortable life. Let's address some common questions. Can hemorrhoids go away on their own? Mild cases often improve with home care, but persistent symptoms need medical attention. Are hemorrhoids dangerous? Most are not, but complications can occur. Is surgery always required? No, most cases are managed without surgery. If you have more questions, your healthcare provider is the best resource. Remember, seeking help for hemorrhoids is a positive step toward better health. There's no need for embarrassment. Medical professionals are here to help. With the right information and support, you can take control of your health and well-being. Thank you for joining us on this informative journey. For more information about hemorrhoids and digestive health, reputable sources include your healthcare provider, national health organizations, and trusted medical websites. Staying informed empowers you to make the best choices for your health. Don't hesitate to reach out for guidance or support whenever you need it. Hemorrhoids are a common condition that can be managed with the right knowledge and care. Early diagnosis, healthy habits, and open communication with your doctor are key to effective treatment. Remember, you're not alone on this journey. Support and solutions are always within reach. Wishing you good health and comfort ahead.